Hey everyone, Dr. T here, and I wanted to talk to you about vomiting. I think there's two major scenarios for vomiting. Vomiting that just occurs in your pet, whether they're a cat or dog, or vomiting that we actually create in your pet. So I'll talk about the latter first. Over the last 2 weeks, we've had 3 episodes of induced vomiting. Induced meaning we, as your veterinarians, give your pet some drug to make them vomit. The first was Angus. Angus is a big black lab, gets into everything. So the scenario goes, my clients are getting their house renovated. They can't use their backyard. So they've had Angus go in their friend's backyard, and their friend has a golden. And I don't know if it's unbeknownst to both parties, but there's huge grapes vines in the backyard, of which their neighbor, who's had 3 generations of golden, none of them ever got into the grapes. Well, in comes Angus, and Angus not only got into the grapes, he convinced their golden to get into the grapes. So, as all stories go, mom calls us up saying, listen, I'm in the middle of doing an interview. My dog ate a bunch of grapes. What can I do? We said, well, why don't you bring him in? Because first thing we want to do is, if this just happened, we can induce vomiting and get the grapes out. So for those of you who don't know, grape toxicity can lead to acute kidney failure and potentially death as a result of that. And it's variable. Some dogs, ironically, can eat a few grapes and not have a problem. Some dogs can eat 1 grape and go into acute renal failure. So our goal is to get those grapes out. Well, it was approximately almost an hour before she could get her mom to bring Angus in. Angus is huge. He's energetic. Her mom is the most petite thing in the world. So she gets Angus in with one of the grandkids came in as well. So the first thing we did was we gave him apomorphine. It is a morphine analog, and a side effect of morphine is it makes you vomit. So it works really well. It works within minutes. And he vomited up about 1.5 pounds of grapes. The beauty of this is that being Angus, being a lab, he just swallowed them whole. So they weren't broken open, so the contents weren't there. So it in the end, not to be gross, but it was when I picked up the bag of vomit that Angus had created for me. It weighed as much as the grapes that you buy in the grocery store, pound and a half of grapes. Did a renal panel on him, did a urinalysis, everything's fine, monitored him afterwards, everything's good. So good story. Yesterday, I get called, Cavalier ate a grape. And, it's one of those scenarios. Let's make her vomit. So we did that as well. We did the apomorphine. Up came some plastic too. So apparently she was chewing on a plastic toy as well. So that's the, we've done chocolate. If they've eaten chocolate, we make them vomit. And chocolate's interesting because chocolate vomit smells like chocolate. And they can continue to vomit up so much chocolate afterwards. So it's important to consider the options. If you've known your pet's eaten something toxic, definitely 2 places you should call is your veterinarian, and depending on what they've eaten, call the SPCA Animal Poison Control, which many times your veterinarian may work with them because there's a lot of toxins that we don't have a lot of database on of how to deal with, and poison control does. So that's human-created vomiting in pets. The other type of vomiting is when your pet vomits, and some pets vomit. I tell my clients twice a month for a dog is actually in the realms of normal. I find dogs vomit if they haven't eaten a meal and their body's primed for it and the bile comes up. I find that dogs will vomit if they happen to get into something that just disagrees with them, that's not harmful. So those are the types of vomits that probably can occur twice a month or so and are in the normal range. So where do I get worried about vomit? I get worried about vomiting if it's more often than twice a month, depending on what's going on with the pet, the age of the pet, and the just overall what's going on, the frequency of the vomit. Are you doing it twice a day, twice an hour? I really don't like scenarios where they vomited like 5 times in a row and the client calls and doesn't want to do anything. Those types of scenarios, those are situations where the vet team member is going to recommend that you come in. So what are common causes of vomiting in pets? For older cats with kidney issue or dogs with kidney issues, kidney disease can lead to vomiting. Liver disease can lead to vomiting. Certain toxins can lead to vomiting. A foreign obstruction in the intestinal tract can lead to vomiting. Pancreatitis can lead to vomiting. GI parasites or other infections can lead to vomiting. So those are different causes of that. And so when your pet's vomiting, we have to determine what's causing it. So if the history is suspicious of a foreign obstruction, they've eaten something foreign. So what happens in many of those cases is they'll want to still eat, but they won't be able to hold things down. And this can go on for days and they'll still be bright. But it's that vomiting you want to see what's in there. So today I got texted from my landlord. Their dog ate 2 tampons. And so ate them immediately. So we're going to probably take some radiographs, see what's going on with that, see where they are, and see what we can do, because I don't know, being absorbable, I don't know what size these tampons will get to or where we're going to be with respect to that. Other foreign obstructions I've seen: toys, rubber duckies. I had a cat that was vomiting that Romeo, was playing with the elastic of a sleeping bag, and I ended up pulling out, I don't know, a total, I pulled out about 10 pieces about this long of this elastic band. You could see it all bright in his stomach, so that was interesting. That was a surgical intervention. Many obstructions are surgical interventions. The concern would be that if it really blocks, then you can get necrosis and death of the tissue in that area. I must have said something that Siri recognized. Siri just said something. But hang on a second. I got it. Hey Siri, stop! Start playing a song. So obstruction. So what we do is we take radiographs, and what we're looking for is either the object in question or an unusual gas pattern. A lot of times where the blockage is, you'll have buildup of gas around that. Many times we can see that. The most notable one I remember way back when I started practicing was a corn cob. Literally, you can see the little areas of the corn. It was an eaten corn cob. It was a lab. So X-rays really determine how things are going. X-rays for non-foreign obstructions, if there's kidney or liver issues, you can see changes in those organs. If there's a potential tumor that's causing that organ dysfunction that's leading to vomiting, you can see that as well. For GI parasites, we run a fecal. For metabolic conditions, kidney disease, liver disease, pancreatitis, blood work is there. Many times you can do an abdominal ultrasound to see what's going on, whether it's metabolic or foreign obstruction. And treatment can range from benign therapy, where we do this wonderful, I call it the drug of the decade, is Serenia, is a wonderful anti-vomiting medication. And sub-Q fluids really help the situation. Antibiotics in many cases. In more severe cases, you may have to hospitalize, follow up on things. And in foreign body cases, you may have to go in surgically to see what's going on. So if your pet is vomiting, it never hurts to give your veterinarian a call, have a discussion. Most often you can kind of determine the cause. They got into something outside, they just ate this, they're in kidney failure and the signs are getting worse. So those are types of scenarios we can do. But I would expect some sort of diagnostic and some sort of treatment. In very benign cases, you can just treat and see how things go. And there are some cases that are fairly benign where a pet gets into a vomiting cycle. And by using anti-vomiting meds, we can actually stop that cycle and they get back and do very well. So vomiting is something definitely you want to talk to your veterinarian about, because it could be nothing, but it could be something pretty cool. Pretty cool to look at afterwards when everything's great, but I mean pretty intense. Does that make sense? Makes sense to me. Remember, everyone, love your pet like they love you unconditionally. Have a great day.